As philosopher Jean-Jacques Rousseau wrote, war is not a conflict between individuals but between states. Once combatants surrender, they become mere men, deserving of protection. In modern conflicts, protecting healthcare and civilians is essential in preserving human dignity and upholding international law. Even in war, there are boundaries that must not be crossed. In the chaos of armed conflict, the principles of humanity must not be forgotten. International humanitarian law, IHL, or the law of war, creates legal protection for health facilities, personnel, and patients in areas of conflict. At the heart of IHL are the Geneva Conventions. These treaties, accepted worldwide, establish guidelines to protect non-combatants, limit the means of warfare, and provide care for the wounded. The International Committee of the Red Cross, Rule 28 states that all medical units exclusively assigned to medical purposes must be protected and respected in all circumstances. Public advocacy has also been essential in holding parties accountable for violations of IHL. These cases underscore the need for cooperation between national and international authorities to strengthen enforcement of humanitarian protections. Despite these legal protections, attacks on healthcare in conflict zones are disturbingly common. In 2019, reports of over 1,200 incidences of violence against medical facilities personnel and patients across 20 countries, with conflict zones exacerbating this trend. When these facilities are damaged or destroyed, the impact goes beyond physical structures. Not only is medical care compromised, but trust in health institutions also suffers, which overall worsens already weak healthcare systems.
An example of which is the humanitarian crisis unfolding in Gaza, where hospitals, typically places of healing, have turned into battlegrounds. With relentless conflict between Hamas and Israel, the healthcare system is being pushed to its limits in unprecedented ways. According to CNN, 20 out of 22 hospitals in northern Gaza have been damaged or destroyed in Israel's response to Hamas, leaving 14 directly hit. Satellite images and ground footage reveal the scale of the destruction, leaving only a few hospitals struggling to meet overwhelming demand. With limited medicine and supplies, doctors face life or death situations daily. Many health workers have lost their lives in the line of duty, yet some continue to work under fire, risking everything to save others. Israel contends that Hamas is using hospitals for military operations, a claim Hamas denies. In response, the Israeli Defense Forces state they would avoid targeting hospitals, but accuse Hamas of endangering civilian facilities. The impact on civilians is massive. Over 3,200 people have lost their lives and over 1 million more are displaced. Gaza's health sector is nearing total collapse, buckling under the weight of the conflict and restrictions, leaving thousands of lives hanging in the balance in what has become a crisis of historic proportions. Fire continues to burn in Europe, where Russia has faced criticisms for these crimes against humanity. So far, dozens of Ukrainian hospitals, schools, and temporary shelter-in-place areas have been destroyed because of Russia's missile and air attacks. In many of Ukraine's major urban centers, Russian strikes have been almost daily. The most glaring and recent of these attacks has been on Kiev's Central Children's Hospital. Moscow launched a brazen daytime aerial assault on targets in cities across Ukraine during morning rush hour, killing at least 43 people, according to figures from authorities. Conflicts such as these are examples of terrorism from above, with state actors attacking mostly non-state actors and civilian targets as casualties. International humanitarian law condemns any assault on hospitals or medical centers, with UN Secretary General Antonio Guterres adding direct physical attacks on hospitals to the list of grave violations against children in armed conflict. But while physical violence can be held accountable in the eyes of the law, there is little humanity can do when natural disaster strikes.
In 2020, the World Health Organization announced that the deadly outbreak of the COVID-19 virus had become a pandemic. The world locked down to prevent increasing casualties, but ongoing conflicts in warring states refused to cease their acts of violence. There was a global call for a ceasefire among conflicted states to prioritize distributing relief goods and services in their states. Yet their rivals saw the ceasefire as an opportunity for military stratification. Countries like Afghanistan and Colombia that called for a ceasefire failed to achieve this. The Taliban stated that they would declare a ceasefire if areas in Afghanistan under their control were hit by the coronavirus. In Colombia, the ELN declared a month-long ceasefire on April 1st, but violence prevailed once May had arrived. Countries with poor economic growth have made acts of rebellion towards their government, whose response to the pandemic was inadequate to support the population. With little to no aid distributed by the government, citizens of South Africa and Kenya defied lockdown protocols, leaving their homes to purchase food and medicine from their local shops. Yet, military actions, such as excessive force and tear gas, were used to shut down these activities. Although it has been a year since the World Health Organization announced the end of the COVID-19 pandemic, the lasting impacts will not soon be forgotten. In times of war and conflict, one of the most overlooked casualties is often sexual and reproductive health. Restricted access to family planning and healthcare leads to higher rates of unwanted pregnancies and unsafe abortions. For women, this often compounds with malnutrition, limited clean water, and inadequate medicine, adding to the already high risks of pregnancy. Studies show that around 21% of displaced women experience sexual violence, though this may be an understatement due to the social stigma and inadequate law enforcement. Maternal mortality rates have spiked, increasing up to 28% in high conflict areas compared to times of peace. Conflict-afflicted regions, such as Gaza, are especially vulnerable. When violence escalated there, an estimated 87,000 women were pregnant, with 4 women per household requiring reproductive health care, a need that was largely unmet. Destruction of healthcare institutions leaves women without essential services and contraceptives, and worsens issues like unintended pregnancies, STIs, and unsafe abortions. In regions like Myanmar, where maternal mortality is already high, an estimated 10% of maternal deaths result from unsafe abortions alone. Peacekeeping missions that also provide security for healthcare facilities can make an enormous difference, protecting not only lives but also the long-term health and stability of entire communities. To truly support post-war recovery, we must recognize that reproductive health is not a luxury, but a necessity. These insecurities in our healthcare systems don't just impact individuals during conflict. They carry long-term consequences that can stall a nation's recovery and development.
Protecting healthcare as a social infrastructure starts with holding those accountable who would exploit the deaths of the vulnerable for their own personal gain. Only in this action can humanity begin to prioritize life and turn away from needless death and violence as a tool for political agenda. Healthcare is a right that every person, regardless of race, gender, or creed, deserves, no matter where you live.